Hello friends, welcome back to our channel. Blocked arteries do not develop suddenly. Over time, fatty deposits, cholesterol accumulation, and inflammation narrow the arteries, making it harder for blood to flow. This increases the risk of serious conditions like heart attacks and strokes. While these blockages progress slowly, the body often gives warning signs that something is wrong. These signs are subtle and easy to dismiss, which is why many people ignore them until complications arise. Recognizing these symptoms early can make a huge difference, allowing for timely intervention before a life-threatening event occurs. Understanding these warning signs can help you take control of your health, seek medical attention when needed, and adopt lifestyle changes that promote better circulation. So, here are 12 key signs that your arteries may be blocked and need immediate attention. 1. Chest discomfort. A feeling of pressure, tightness, or burning in the chest is often one of the first signs that something is wrong with your arteries. This occurs when the heart isn't receiving enough oxygen-rich blood due to blockages in the coronary arteries. The discomfort can be mild or severe, and it might feel like a squeezing sensation, heaviness, or even heartburn. Many people experience this pain during physical activity or moments of stress, but it typically subsides with rest. However, as blockages worsen, the pain can become more frequent and intense, occurring even when you're at rest. This condition, known as angina, is a major warning sign that your heart is struggling to get the blood it needs. Some people mistake it for indigestion, delaying necessary medical attention. If you notice chest pain that comes and goes, lingers for more than a few minutes, or worsens over time, it is important to seek medical evaluation. Waiting too long can increase the risk of a heart attack. Monitoring when the pain occurs, what triggers it, and how long it lasts can help doctors determine the severity of the blockage and recommend appropriate treatments to restore proper blood flow. 2. Shortness of breath. Finding yourself short of breath, even during mild activity or when lying down, could be a warning sign that your heart is struggling. The heart needs to pump oxygen-rich blood efficiently, but when arteries are clogged, it has to work much harder to circulate blood through the body. As a result, fluid can accumulate in the lungs, making breathing more difficult. You might feel breathless when climbing a few stairs, walking at a normal pace, or even while at rest. In some cases, shortness of breath can be accompanied by a feeling of tightness in the chest or sudden fatigue. People often dismiss it as being out of shape or simply aging, but when it happens frequently or worsens over time, it may be a sign of an underlying arterial blockage. If breathlessness occurs without an obvious reason and persists even when you are not exerting yourself, it is essential to have your heart health evaluated. Ignoring this symptom could increase the risk of serious complications, including heart failure. Regular checkups, staying active, maintaining a balanced diet, and keeping cholesterol levels in check can help prevent blockages from worsening and improve circulation over time. 3. Pain in the arms, neck, jaw, or back. Heart-related pain does not always present itself in the chest. Blocked arteries can cause discomfort in the left arm, shoulder, jaw, or back, often leading people to believe they have a muscle strain or a pinched nerve. The pain can feel dull, sharp, or radiating, and it may come and go unpredictably. In some cases, the discomfort worsens with physical activity and subsides with rest, which is a sign that the heart is struggling to receive enough blood. Women, in particular, tend to experience this kind of pain more frequently than men, sometimes mistaking it for joint problems or stress-related tension. This symptom is especially dangerous because it does not always accompany the classic chest pain associated with heart issues. Ignoring it can delay diagnosis and treatment, increasing the risk of a heart attack. If you notice persistent pain in these areas without an obvious cause, or if it worsens with exertion, it is important to seek medical attention. 4th, leg pain and cramps. Pain, cramping, or numbness in the legs while walking or climbing stairs can indicate peripheral artery disease, a condition caused by narrowed arteries in the legs due to plaque buildup. As circulation weakens, Muscles receive less oxygen, leading to discomfort that typically subsides with rest but returns upon exertion. Over time, the pain may become more persistent, occurring even while at rest. Many people mistake PAD symptoms for aging or muscle fatigue, delaying treatment and increasing the risk of severe complications. In addition to leg pain, cold or pale feet, weakened pulses in the legs, and slow-healing wounds on the feet or toes may also signal circulation issues. In advanced cases, sores may develop due to the lack of sufficient blood supply, and these wounds can take weeks or even months to heal. If left untreated, PAD can lead to serious conditions like infections or even limb amputation. Lifestyle changes such as regular exercise, a healthy diet, and quitting smoking can help manage symptoms and improve blood flow. 5. Erectile dysfunction. Men who experience persistent erectile dysfunction may be dealing with more than just performance concerns. The ability to achieve and maintain an erection depends on proper blood flow, and when arteries become clogged, circulation to all areas of the body, including the penis, is reduced. This can make ED one of the earliest signs of vascular problems. Many men dismiss ED as a natural part of aging, but research suggests that it can be an early warning sign of cardiovascular disease, often appearing years before more serious symptoms such as chest pain or shortness of breath. When arteries are narrowed due to plaque buildup, blood struggles to reach essential areas, increasing the risk of heart attacks and strokes. Men who experience ongoing erectile difficulties should not ignore the issue, as it could be a sign that their arteries are not functioning optimally. Lifestyle changes such as maintaining a healthy diet, exercising regularly, and managing cholesterol levels can improve circulation and reduce the risk of further complications. 6. Dizziness or lightheadedness. Frequent dizziness or feeling faint may indicate that oxygen-rich blood is not reaching the brain efficiently due to restricted arteries. This symptom is often dismissed as dehydration or low blood sugar, but in many cases, it is a warning that circulation is compromised. When arteries become clogged, the heart has to work harder to push blood through narrow pathways, which can result in sudden drops in blood pressure when standing up or engaging in minor physical activity. These episodes can be brief or prolonged, sometimes accompanied by blurred vision or confusion. If dizziness occurs frequently or without an obvious cause, it should not be ignored. Poor circulation to the brain increases the risk of stroke and other serious complications. Keeping track of when dizziness happens and what triggers it can help identify underlying artery blockages. Making changes such as eating heart-healthy foods, staying hydrated, and engaging in moderate exercise can improve circulation and reduce the likelihood of dizziness caused by poor blood flow. 7. Fatigue and weakness. Feeling unusually tired despite getting enough rest may be a sign that your heart and muscles are not receiving enough oxygen-rich blood. When arteries are clogged, the heart has to work harder to pump blood, leading to reduced energy levels. Everyday tasks such as walking, climbing stairs, or even getting out of bed may feel exhausting. This type of fatigue is different from normal tiredness, as it does not improve with rest and may gradually worsen over time. Women, in particular, often experience extreme fatigue as an early sign of heart disease, yet it is frequently overlooked. The fatigue may also be accompanied by dizziness, shortness of breath, or chest discomfort. Since this symptom can be subtle and easily attributed to stress, aging, or lack of sleep, it is important to pay attention to persistent, unexplained exhaustion. Lifestyle changes such as improving diet, increasing physical activity, and managing stress can help improve energy levels and cardiovascular health. 8. High blood pressure that won't go down. When arteries become clogged, blood struggles to move through them, forcing the heart to work harder to maintain circulation. This increased effort raises blood pressure, which can remain high even with medication. Many people assume that high blood pressure is simply a result of genetics, stress, or diet, but when it persists despite lifestyle changes and treatment, it may indicate that arteries are narrowing due to plaque buildup. Over time, This can weaken blood vessels and increase the risk of stroke, heart attack, and kidney damage. Some people experience symptoms such as headaches, dizziness, or nosebleeds, but in many cases, high blood pressure remains silent until severe complications arise. Regular monitoring is essential, especially if your readings remain high despite taking prescribed medication. Lifestyle adjustments such as reducing salt intake, managing cholesterol levels, and exercising regularly can improve circulation and relieve strain on the heart. 9. Swelling in the feet and ankles. Swelling in the feet and ankles can signal that your heart is struggling to circulate blood efficiently. When arteries become clogged, the heart has to work harder to pump blood throughout the body, which can lead to fluid retention in the lower limbs. This occurs because the restricted blood flow increases pressure in the veins, causing fluid to leak into surrounding tissues. The swelling may start mildly, but can become more pronounced over time, especially after prolonged periods of standing or sitting. Some people also notice that their shoes feel tighter, or they develop a feeling of heaviness in their legs. If the swelling persists, it is important to monitor whether it worsens, spreads to other areas, or is accompanied by additional symptoms such as shortness of breath or chest discomfort. In some cases, swelling in the legs can also be related to kidney or liver problems, but when it occurs alongside other cardiovascular symptoms, it often points to arterial blockages. Keeping feet elevated, reducing salt intake, and staying physically active can help manage mild swelling. 10th. Slow healing wounds on the feet. When circulation is compromised due to clogged arteries, the body's ability to heal slows down significantly. Cuts, blisters, or sores on the feet that take an unusually long time to heal may indicate restricted blood flow. Without sufficient oxygen and nutrients reaching the affected area, the skin struggles to regenerate, increasing the risk of infections. This issue is particularly concerning for people with diabetes, who already have an elevated risk of circulation problems and foot ulcers. In severe cases, untreated wounds can become infected, leading to tissue damage that may require medical intervention. People experiencing slow wound healing should regularly inspect their feet, keep their skin moisturized, and avoid injuries by wearing protective footwear. Keeping blood sugar levels in check and maintaining a diet that supports vascular health can also help improve circulation. If wounds persist for weeks without improvement or show signs of infection, seeking medical evaluation is necessary to prevent complications and ensure proper healing. 11th. Skin discoloration or temperature changes in limbs. Changes in skin color in the legs, toes, or fingers, such as turning pale, bluish, or reddish, can indicate poor circulation due to artery blockages. These color shifts occur when blood flow is restricted, depriving the tissues of oxygen and nutrients. In addition to discoloration, the affected area may feel much cooler than other body parts. This is a serious warning sign that should not be ignored, as prolonged reduced blood supply can lead to tissue damage. Sometimes the skin may also become shiny, and hair growth in the affected area may slow down or stop altogether. If blood flow continues to decline, numbness or tingling can develop, making it difficult to feel temperature changes or minor injuries. Left untreated, severe blockages can lead to ulcers or even gangrene, which may require amputation. Regular physical activity, avoiding smoking, and following a heart-healthy diet are essential to improve circulation. 12th, mini-strokes. Experiencing sudden difficulty speaking, temporary vision loss, or weakness on one side of the body may indicate a serious problem with blood circulation to the brain. These episodes, often called transient ischemic attacks or mini-strokes, occur when a temporary blockage limits oxygen supply to brain tissue. Unlike a full stroke, the effects of a TIA typically resolve within minutes to hours, but this does not mean they should be taken lightly. A mini-stroke is a critical warning that arteries supplying the brain may be narrowing due to plaque buildup, increasing the risk of a major stroke in the future. Other symptoms may include dizziness, confusion, or sudden loss of coordination. Many people dismiss these warning signs, assuming they are related to fatigue or stress. but failing to seek medical attention can have life-threatening consequences. Recognizing these symptoms early allows one to address underlying artery blockages before permanent brain damage occurs. Final thoughts. Artery blockages can go unnoticed until they cause major complications like heart attacks or strokes. Paying attention to these subtle warning signs can help you take action early. If you experience any of these symptoms, seek medical advice immediately. Your arteries play a vital role in keeping you healthy. Don't wait until it's too late to take care of them. If you found this information valuable, don't forget to like, share, and subscribe to our YouTube channel for more health tips and updates. Stay informed, stay healthy, and take control of your well-being today.